Going to talk a little bit about joining with families. Joining is always going to be the very first task that you do as a family counselor, and it is really critical to your success because it's your opportunity for the family to start to build trust with you. And it's only if that family is willing to let you into its system and start to work with them that you'll be able to get anywhere as a family counselor. So, this is a very, very important technique, tool, just fundamental foundation of family counseling is this idea of joining. And as your textbook discusses, the personhood of the family therapist, who you are as a family counselor, is really, really important because it's your experiences that are going to shape what you attend to. And oftentimes people start off in family counseling before they've really had a lot of experience in different roles within a family. Not everybody comes into being a family therapist by the time they've experienced being a child, being a parent, and being a grandparent. But certainly we have to come to understand those roles even before we've ever entered them. And some of those roles we may never actually choose to enter for people who want to be family counselors but actually not have children themselves, which is totally possible and totally fine. Along that line, just to give you a bit of an idea, as I was learning to become a family counselor and to appreciate the process of family counseling, I was in the process of going through a divorce. And so it was very challenging what was happening in my own family life, and then working with families who themselves were struggling with some issues that I was sorting out too. So your textbook talks about a lot of things that are really helpful, and regardless of whichever theory or model of family counseling that you choose, your textbook kind of addresses a lot of things that are common to all types of family counseling or family therapy. But I want to go through and do my kind of top 10 list with you. And sit back with just some of the things that I've learned over the years that I found to be areas that I needed to focus on, really pay a lot of attention to. So before I get started in reading my top 10 list, I want to just share with you this paragraph at the top of your handout here. And that's that joining family with families is critical to your success as a family counselor. You want to build a working alliance with the entire family and not be overwhelmed by the power of the family unit. You get involved with the family, but you also remain separate from it. You identify with the children's point of view and with the parents. As Carl Whitaker said in 1965, the work with families is the ultimate challenge, the ultimate excitement, the most dangerous, and at the same time, the most deeply satisfying work that a psychotherapist can attain. It is a real life and death struggle, and the life you save may be your own. I like that statement a lot because I found it to be true. Working with families, it is very exciting, it is very challenging, and if I were to enter into practice again, it's exactly the kind of work I would want to do. It's very powerful, it's very effective. It's hard to get a family together to come and show up and work. They have to be vulnerable to you and they have to be vulnerable to each other. And probably because of the fact that they're seeking family counseling, they're not excited about that idea of being vulnerable with you or with each other. But also, working with families is a great way to know and understand yourself and your family better. And that's why doing a family genogram on yourself is really important. So here's my top 10 list. The first thing is, as much as is possible, try to sit back, relax, and get to know all the family members. When you begin doing family counseling, it can be very intimidating. And if you're someone who doesn't work with families on a regular basis, let's say, for example, you're a school counselor and only occasionally do you meet with the parents, you have to go in and out of what it's like to work with individuals to what it's like to work with a family, and it's different. So when you go into a room, or you go into a family's home, if you're doing in-home family counseling, try to sit back and relax and really try to take some deep breaths before you get started. It can be very intense. There can be a high level of emotion, either hidden and be like the elephant in the room, or there can be a high level of emotion that's right there out on the surface. But whatever it is, make sure that you try to get to know everybody in the family, even the quiet ones. You want to know the children, you want to know the adults. And then, second, number two, introduce yourself and be you. So, whoever you are, be honest about your skill level and what you're bringing to the family counseling situation. It's okay to introduce yourself and say that you're a student. It's okay to introduce yourself and say that you're a provisionally licensed counselor and under supervision. Be honest about who you are. Families will respect that. And if you don't know the answer to something that they ask, you will consult with your supervisor and you will get the information. You aren't expected to know everything there is to know about families. It's just not possible. But you will have a foundation through your thorough studying of your textbook and the articles and progressing through your program and experiences that you build up over the years. You will have a thorough understanding. But always, at any point, the family is going to be an expert at themselves more than you will ever be able to be. So you're not going to be an expert on that family, but you are the expert in the room about working with families, and you can do that. So just be yourself. And if you are someone who is quiet and subdued, then you're going to be a quiet and subdued counselor. But if you're a lively and interactive and very directive counselor, then you're going to be you at that. And that's okay. There's room in the profession for lots of different styles. As we get into each of the models of family counseling, you will see that it's really the personalities of the founders of those models of counseling that brought a lot of themselves into their theoretical approaches. So you need to bring you. Number three, share information about what the family can expect in family counseling and find out if this is the family's first time in counseling. Some of the members of the family may have been in individual counseling, and others have received no counseling at all. The family might have come on to family counseling in the past and had a great experience or had a terrible experience, but all of that matters, and you need to find out a little bit more about it. You also want to let the family know that sometimes you're going to get them to talk to each other, and sometimes you're going to get them to talk to you. Sometimes you might have to interrupt. You want to let the family know what are the ground rules. Are they allowed to cuss at each other? Are they allowed to scream? What can they expect? You want to provide them with information at the start that demystifies the therapeutic process for them, because they already have anxiety, they already have concerns and worries and resistance, and you want them to know what to expect. You want them to know what you are expecting of them, and they want to know what to expect from you. So a lot of times I'll start off by putting my hands up in a way that a coach calls a timeout with say my left hand fingers pointed up and my right hand palm on top of my left fingers, making a timeout symbol. And I'll start off by telling families that at times I may interrupt them with that timeout symbol. And that's their cue to stop talking. And at that point, then I might kind of take over and redirect or introduce an activity or do something else. Other times I might actually turn my chair a little bit away from the family and encourage them to talk to each other. And in that instance, I'm slipping into more of an observer role, and I don't want them to tend to look towards me. We'll talk about that technique more when we discuss enactments during structural family therapy, but that's a very helpful tool to use too. Your body language is important. And that's directly related to number 4. Be sure to make verbal and eye contact with every family member. You want to talk to the children and you want to talk to the adults, and you need to look them in the eye, and you need to make an effort, because sometimes there can be a very chatty family member that gets in the way of you being able to communicate with the more quiet, less eye contact producing or evoking family members. But it's your role to make contact with everybody. And then you also want to clarify, is everybody present? Is everyone who's involved in the family actually in the session, or is there somebody important who's absent? And as you go through the session and you start to hear the family story, you want to make sure that you acknowledge all points of view. So you may agree with one of the points of view that is expressed within the family, but you have to acknowledge that you understand and you get what that angry 15-year-old is saying and what the angry 38-year-old parent is saying. You want to acknowledge everybody's point of view without necessarily condoning or aligning at this early stage with one particular point of view. And number 5, don't rush to do an intervention. Really spend time getting to know the family. It is therapeutic for the family to be with you, who is mediating and moderating their conversation, their communication. It's therapeutic that they all showed up in the same room to work on a problem together. So don't rush to add extra interventions on top of that. Let them talk, let them get to know you, let them get to understand what they can expect out of the process, what you have to offer, but don't rush to do any fancy techniques or anything. Really spend a lot of time building that relationship. Sometimes when I was doing family counseling, I would feel compelled to get in there and do something because I knew the family was hurting and I wanted to fix it. I wanted to take away their pain. But when I would take my tapes back to my supervisor and he would look at them, he would say, "It's okay. Change is happening. Just keep getting to know them and trust that the building of the relationship is getting somewhere." And he was always right. You will never waste your time spending time building relationships with family members. Number 6 would be to show interest and convey empathy. Show interest by, kids oftentimes wear characters, cartoon figures on their shirts. Ask questions about that. If you ask questions about the family and the parents' work or their lack of work or religious practices that the family has, or typical things they do, things they used to do. Act interested in the things that they want to talk about and the things that they are bringing up, not just the things that you think are on track with where you're going as the family counselor. Relatedly, number 7, be curious, ask questions, and don't bluff. If the family starts telling you about something that's maybe specific to their culture or specific to drug use or specific to a discipline technique, ask questions and don't pretend that you know the answer, because letting the family know that you don't understand what they're saying rather than bluffing along, that helps to build the rapport in the relationship. And usually someone in the family can see through you if you're trying to bluff. So don't be afraid to not know. You want to also make sure that you're aware of if the family has been through a recent transition or a change. Sometimes they come in talking about a problem, very often a child's behavior, and then later you find out that a grandparent has just died or a parent has been deployed in the military. The family has just moved. Some major life incident has happened. So it doesn't always occur that families naturally bring those things up. So you might want to ask about that, because that's really important and really stressful on a family to negotiate going through a major transition or change, such as a job loss or someone moving in, someone moving out, all of those different stages of the family life cycle. Number 9 is complement positive actions, search for resilience, and offer hope. Complementing a positive action might be when a parent corrects the child in session, then you can turn to that parent and you can say, "I really like the way you got Johnny to sit still in his seat." Or you can turn to a sibling relationship and you can say, "Johnny, I really liked that when your sister asked you to stop pulling her hair, you did. That was really good." Or when two parents are talking and one of them is giving good eye contact, then highlight that and say, "When I'm watching you all talk to each other, I just notice how Bill really pays attention to what Steve is saying by making good eye contact, and that's really powerful. Keep doing that." Those are the kinds of compliments that you want to give as a family counselor. And then get the family to ask you some questions before every session ends. Make sure you have a little bit of time set aside so you can ask the family if they have any questions. And I'll leave you with a story. from when I only have a few seconds left in this recording, but when I was a teenager, my family went to family counseling, and my stepfather started to, I can't remember if I've shared this in a recording before or not. I'm having a deja vu moment, but my stepfather started to rant and rave, and we all started arguing in the session, and my mom felt like all hope was lost. But the counselor turned to her and said, "There's a lot of love in this room.